Joining us now is Nicole Wolf, who is the Senior Director of Hospice and Palliative Care, Lake Norman. Thank you for being our featured business this week.
Thank you for having us. We're delighted to be here with you.
Well, I'm glad you're on too, because it's something that maybe a lot of people don't know that much about. What, most people have heard of hospice, but tell us about your organization, how long you've been around, and what exactly it is.
Okay. Well, we are Hospice and Palliative Care Lake Norman. We are the hometown hospice for the Lake Norman community. Our organization serves patients and their families in their home or home environment through physicians, nurses, nursing assistants, chaplains, social workers, and volunteers. We have been serving patients in the Lake Norman area for over 30 years.
Oh, okay.
Wow. And how does somebody know when is the right time to call your organization in to support the family?
Right. We educate the community and physicians on what our services are and our variety of services. Typically, we tell people when they have a chronic illness, ongoing illness that they're having symptoms from, to pick up the phone and call. We can decide and help them understand whether or not they are ready for which level of service that we offer. Our hospice services are geared towards patients who have been diagnosed with a life-limiting illness. Typically, that's months versus years. However, none of us really know what that time frame is. The important thing is that the patients get the referral and come to hospice services earlier rather than later.
Now, what are the different services that you offer, though? You mentioned hospice service. There's, I know you work with children. So are there different stages or different
There
levels?
are. Our organization provides hospice services, palliative medicine, pediatric care, as well as educational offerings to the community. Hospice services, as I said, are geared towards patients who have months versus years to live for a variety of diagnoses. A lot of people assume that hospice equals cancer, which is not true. Our patients actually make up about 48% in terms of having a cancer diagnosis. The remainder of those patients have dementia, Alzheimer's, heart disease, kidney failure, lung diseases, so a variety of illnesses that can be at their latter to end stages of a person's life. Palliative medicine is a relatively new term in the last several years, and our organization prides itself on having one of the largest palliative medicine programs in the United States. Palliative medicine is a specialty that is provided to patients who have more of chronic illness but are suffering from symptoms that need to have management, ongoing pain management, shortness of breath related to a pulmonary disease, and that's a specialty that our practitioners and physicians can provide. Pediatric care is provided to patients, children from birth to 18, who have either serious, chronic, ongoing illnesses and or life-limiting illnesses. And we provide home health care and hospice care to children through specialty trained nurses, chaplains, social workers, and physicians who can meet their special needs.
Now, are these the team that you have that work, is this a team that's strictly within your organization, or is this different doctors within the community that you use, or how does that work?
Our organization, Hospice and Palliative Care Lake Norman, is a regional office of Hospice and Palliative Charlotte region. So we're the local community hospice, but we have the resources of a much broader scope. Our organization employs many physicians and nurse practitioners who actually work for our organization, who are specially trained physicians and nurse practitioners in palliative medicine, hospice and palliative medicine. However, when a patient's referred to hospice, in most situations they retain their own physician, and we work with that physician for the patient and family, and we're sort of the eyes and ears of that patient's physician, and work with them on coordinating plans of care individualized for that patient. However, we're very fortunate to have physicians who are able to go into the patient's home if needed to manage symptoms. Many times patients cannot get out and about when they're undergoing symptoms and towards the end of life. And so to have a physician or a nurse practitioner come to sit at your bedside and talk with you and your family about what is going on, and to speak with your physician to physician about a plan of care that's just right and individualized for that patient is a truly blessing.
I would imagine also, even if they could get out and about, they may not want to.
Right.
That's not the way you want to spend that last 2 days.
To preserve their energy, regardless of what they want to do. Many of our patients were able to manage their symptoms so that they can take trips to the beach, the mountains, even to another country or a cruise. We're able to get them to a point to where their quality of life is to a level to where they can enjoy time that they have left with their family, be it weeks, months, whatever time they have left.
Yeah, that's so important, and it's something that families do really need support with. I mean, it's not the kind of thing that you hopefully go through more than once, and so to have somebody that is accustomed to dealing with situations and they can provide the support and advice and medical attention and everything is a really great resource.
Well, thank you for being our featured business. And also, just in closing, is there anything else you wanted to share with the viewers before we close? Or?
I would like to encourage people to pick up the phone and call. A lot of people, as you said earlier, wonder, when is it time? And our goal is to have patients come on board and to be able to benefit from hospice services. Many people have the myth that hospice is final days, and it's not. It's final months, and sometimes it can even be more than 6 months, close to a year. So to call and just let us help you. Our website is www.hpccr.org, and there we have information about our education, our services, and how to get in touch with us.
Great. Well, thank you so much.
Thanks.
Thank
That's
you.
very helpful.
Appreciate it.